Knock, knock. Hi, my name's Crystal. I'm a student nurse. I would shut the door for privacy. Today I'm going to be giving you IV therapy or IV antibiotic, and I do have an active order to do so. So today I'm going to be giving you Cefazole, 1 gram. Can I have your name and date of birth? Joe Smith, 10/5/53. Okay, Joe. Do you have any allergies? No? Or sulfa? Yeah, okay. Well, there's nothing containing sulfa today, so you'll be okay. So first I'm going to make sure my primary line is infusing into the arm, and so that's good. I would make sure I wash my hands. I don't need gloves right away, but I will later. So then I'm going to talk to you about Cefazole. So I've got Cefazole sodium, Anza, which the safe dose is 150 or 250 milligrams to 1.5 gms every 6 to 8 hours. The indications are treatment of serious infections of bones, skin, joints, soft tissue, respiratory tract, biliary tract, and GU tract. And then I've got the dilution of 50 to 100 milligrams per dextrose or normal saline. And then I've got a related diagnostics would be to obtain PT and monitor vitamin K. Rate of admission is 1 gm or over the 3 to 5 minutes. Precautions are hypersensitivity reactions. You want to be careful and watch patients with impaired renal function, allergies, history of GI disease, and again, with patients that have impaired renal function, you want to be careful if they're being administered high doses to watch for seizures, because that could occur. Side effects are anorexia, CDAD, diarrhea, increased bun and creatine levels, and hypersensitivity. There's no antidote, but you would want to notify a physician right away if you see side effects, and to just continue the drug right away. So then I'm going to be looking at the arm for signs of phlebitis, which would be soreness, warmth to the touch, tenderness, redness, and then I don't see any signs of phlebitis. So then I'm going to look for signs of infiltration in the arm, and that'd be the surrounding vein would be pooling from the IV, and then underneath the arm would be pooling like a big thing of water underneath the arm, which I don't see any infiltration. So then I'm going to go ahead, and I made sure my primary bag was infusing into the arm already. So I'm going to go ahead and do my first check against the MAR. So I've got Cefazole 1 gram, Cefazole 1 gram, not expired and it's still intact and not discolored or crystallized. So then I'm going to go ahead and do my math right away. I've got 50 milligrams over 40 minutes, which would be the hourly rate, and then I'm going to break it down into minutes. So I've got 10 drops per minute, and then I've got 12.5 drops per minute. So then you want to divide the 12.5 by 4. You get 3 drops per 15 seconds. So then I'm going to go ahead and do my second check against the MAR. So I've got Cefazole 1 gram, Cefazole 1 gram, still intact, good. And then I'm going to do my 5 patient rates. So I've got right patient, right medication, right dose, right route, and right time. So then I'm going to go ahead and wash my hands again just in case. Put my gloves on. And I'm going to perform my third check. So I've got Cefazole 1 gram, Cefazole 1 gram. I'm going to go ahead and open that. Then I've got my primary tubing, which is still intact and not expired. It's still intact and not expired, so I'm going to go ahead and open that. I'm going to grab out my extension, get that out of the way right away. And then I'm going to go ahead and open up my tubing. I'm going to go ahead and shut it right away, shut my clamp. So then I'm going to go ahead and open my Cefazole. Maintaining sterility, I'm going to go thumb to thumb. I'm going to go ahead and hang this up on the IV pole. And then I'm going to go ahead and disinfect the port for 30 seconds, nice and hard. Scrub, 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 scrub. Okay, so it's been 30 seconds. Maintaining sterility, I'm going to uncap my IV, my medication, thumb to thumb. And then I'm gonna go ahead and prime my bag, or my lines. So then I'm watching to make sure my chamber for my antibiotics fills up halfway. So then I'm gonna go ahead and hang this back up here. And then I'm going to get my drip rate factor. So I want 3 drops per 15 seconds. So I'm going to go ahead and start, open my clamp, and I want 3 drops per 15 seconds. So I've got, you probably can't see this, but it's bad angling. So I've got, starting now. 1, 2, 3, and just in case I'm going to check again, so 1, 2, 3. Okay, so then I would grab a piece of tape, label my drug with my initial, my date, and my time, and then along with my tubing, I would do my initials of the date and the time. I would discard my gloves, and then I'm going to walk you through taking out an IV port. So I would put a padding underneath the arm, and then I would wash my hands and put on new gloves. And then I would carefully pull back the dressing on the IV port while holding a 2x2 gauze on top of it, not applying any pressure, just slightly pushing or slightly putting my fingers down on it, slowly and carefully take it out. Apply pressure for 1 to 3 minutes where the IV used to be. Discard of that one, grab a new 2x2 gauze, tape that down for pressure, and then I would ask, Joe, is there anything else that I can do for you today? No? Okay, well, I'll just be around the corner documenting, and then I'd be documenting. Thank you.